So, good day to everyone. So, we're joined here today by our friend, Mr. Dominic Darbuscher. He graduated from the Imperial College in London, England, with bachelor's degree in chemistry, and obviously went into the marketing field. So, can you please greet our viewers, Dominic? So, they are from the academic community. We have students, parents, stakeholders in the education sectors, faculty, and administrators now viewing us in our virtual channel.
Hello, everybody. It's nice to see you all. I'm Dominic Patrick Darbuscher.
Yes, so thank you so much for joining us today. So Dominic, we really are so interested, firstly, in your interest as a young person. When and how did you actually develop an interest in the field of study, which is chemistry, which is what you first studied?
Yes, it's difficult to say when. I always had an interest in nature and how things worked. So I was always very intrigued about how anything worked, to understand the underlying rules for the development. So it was chemistry, biology. I was always very interested in science from a very early age, which I pursued. And when I was in high school, obviously in the UK system, you have to really choose at an age of 16. You're choosing which subjects you're going to specialize in at a very early age.
The O and the A levels, correct?
Yes. So the O level is 16. You can choose 9. So I did do science and I did do arts, I did do English, etc. I feel that having to choose at such an early age is very strange. It's a very strange system, the UK. You have to specialize very early. Because
so this
after
is around
the O
the age
levels,
of 16, right?
yes,
Usually the age of 16.
yes. So the O levels are the age of 16, and then you have to choose your A levels. You're only going to do 3 A levels. People will always say to you, either you do science subjects or you do art subjects. You can't mix them. You have to choose. I feel the English system forces people into a certain pigeonhole at a very early age when you don't know what these careers will do for you, what this qualification will give you later on in life.
Yes.
I find that quite an odd system.
Yeah, so you mentioned about your early interest in how things work and also in the sciences, right? So what sort of like experiential learnings eventually you think guided you to develop those skills and proficiencies in the field of study that you eventually did pursue?
I think I'm the youngest member of a very large family. So my older brothers and sisters, they all seem to have an interest in nature and similar things. So I was exposed to actually their like opinions at quite an early age.
Yes.
They didn't study science, but they were certainly interested in some of those areas. My elder brother did study in geology, so there was certainly some influence from my elder family members that I was exposed to at quite an early time. They were all interested in that type of subject.
Yes. So that kind of inclination, how did it eventually guide you to developing those skills and proficiencies that you would have needed? You mentioned about the O level and the A levels that you would have to take on and then eventually go into university.
Yeah, sure. I think some of it is I think the teachers you have for like different subjects will also influence you very heavily. If you like the biology teacher, if you get on with the chemistry teacher, and you have a certain proficiency in that subject, maybe it's a sliding doors moment. You know, there's one thing in your life you don't actually recognize it at the time. Because I could have gone in a different direction. I certainly could have studied art subjects. I was equally as good at the ages 17, 18. Perhaps I preferred the science teachers. I like the rigor of science. It's logical. It makes sense. It fits together. You know, there was certainty in science. Perhaps I like the certainty. You know, I like to understand how things worked, and there was an answer there.
So you really
So there is a range of factors there.
Yeah, so you mentioned about the different influences, inclinations, and so it's really an identification of the interest, and then after that, of course, is your decision, and this is quite vital for the young people to eventually know. But you did mention about your opinion on why they would have to make a decision so early on. What do you think would be a more appropriate time to actually make a decision about your field of study?
I would rearrange the whole of education. I
Yes.
think people are living so much longer now, certainly in the
Mm,
West. People are living to be well over like 100.
yes.
And they're quite healthy until an older age. So I would push back the entry into university until 25. So I think people
Really.
should do basic schooling in a
Mhm,
general nature, and then they should work for 2 or 3 years and then
mhm,
go to university. I
okay.
think this rush to university in the
Mhm,
UK, it is 18. I mean,
mm,
what do people 18 know? Absolutely nothing, as all us old people now know.
yes.
18-year-olds are clueless, but you're forced into it at that age. And you're going
Mhm,
to live for a very long time, so there's no rush. I think the timetable was based
mhm,
on people dying at 55, 60,
yes.
That
Mhm,
doesn't happen anymore. So
yes.
I think that's, go on.
So you mentioned about working, as you mentioned, like take some basic education and then working. Actually, this is a kind of model that is being discussed now about what they call dual technology. It's the practical learning or the experiential learning. So, what do you think is really the value of being in this work environment that could be an asset or a lesson for the young people before even deciding about their field of study?
Well, because I think people have some underlying talents or skills which
Mhm,
which would lend themselves to a particular career choice. Most
mhm,
people don't know what they are, and they're never uncovered. So it
mhm.
seems to me to be a random bumbling around in a dark room and bumping into things. You
Yes.
know, I remember I'd been working for quite a long time. The company I was working for was a big multinational. They were
Mhm.
very keen on psychometric testing to
Yes.
find out hidden skills and to try to form
Aptitude. Yes.
teams. Yes.
Yes.
And so they pursued this quite vigorously, and they did several different types of tests with consultants. I remember a Thomas International, which is a psychometric
Yes.
personality test, and
Mhm.
and and my results said that I would be good at it was R&D,
Mhm.
marketing, and
Yes.
teaching, and those
Yes.
were the recommendations. Now, I,
Uh,
I actually got that report when I was 35, so I'd
Yes.
already worked in R&D, I'd worked in marketing, and I
Yes.
went on to work in teaching.
Yes.
I'm very surprised about how accurate some of these psychometric testings are becoming. But I
Mhm.
think even a simplistic one does show you the underlying skills you have. Are you
Mhm.
quantitative? Are you qualitative? Do you like people? And
Mhm.
that isn't done at any stage in any school. We
Mhm.
don't say to people, you might be quite good at this,
Yes. So
which
when
I
you
find
did,
strange. Go
yeah,
on.
even if you had like this background on chemistry, as you mentioned, even before you took this psychometric test that you mentioned from Thomas, you had in fact gone into a different direction. So how did the inclination towards marketing develop for you?
Yeah, sure. Well, I was working. I did actually work in the science field for, for after I finished my degree. I did work in research and development for a
Mhm.
chemical company. Um,
Yes,
Clearly, in research and development, you're trying to produce new products that customers want. The
yes,
company that I worked for, I didn't think there was anybody who was finding out what the customers wanted.
yes.
So I simply expanded into that role myself. It was
Mhm.
the type of company where if you spotted a gap and you started doing it, they would just
Yes,
let you do it. It was a successful company. It had enough
very
money to let
innovative.
people,
Yes.
yes,
Mhm.
it had enough money to let people do strange things, and sometimes they would
Yes.
work. So
Mhm.
that's how I started. I took my knowledge of the product base and how to improve the products, and I
Mhm.
moved that into the marketing to actually then try to understand what the customers wanted and to fix
Mhm.
the two together. So that was
Mhm.
the very start of it. And it basically just evolved them organically within the company.
Mhm.
Subsequently, I did an MBA, and then
Mhm.
I did a master's in marketing. So I subsequently worked, within the same company as a marketing director. So it
Mm-hmm.
was, again, it was another skill that I had, really. I didn't think I had that skill when I didn't think I would ever work in marketing. But when I
Mm-hmm.
was younger, I wasn't
Mm-hmm.
very good at talking. I wasn't very good at meeting people. I had very low personal confidence. So I
Mm-hmm.
couldn't have done that until I'd worked for 10 years.
Mm-hmm. So different
It was an
stages.
evolution. Yes. Yes,
Yeah, so it's
definitely.
an evolution. And then, as you mentioned, eventually also, maybe the metamorphosis is that how then did you think that you would find yourself in education? So it's different when you're a scientist, you're in research and development. That's one skill set. And then eventually marketing, there's a lot more interaction with people. And then teaching, again, there's a different role and responsibility for education.
Yes, there is. And I wouldn't have done teaching unless I'd done the marketing first, because I
Yes.
became more of a salesperson. I became more able to talk to people. I
Mm-hmm.
became better at dealing with them new people because I was working in a marketing. But if I
Mm-hmm.
now went back to the start, I would be better at any job now because of all the different things that I've done. If I went
Yes.
back to marketing or even to research and development, I would be much better. And teaching has actually helped me in many ways. I've learned a lot through the process of teaching and the
Mhm.
process of moving around the world and having
Yes.
working in different cultures, clearly.
So when you talked about the exposure to different cultures, because now we look into the international relations foray and the understanding, and this is like one of the objectives I think of education is really having that possibility for people to understand that you're imbuing your students with the tools. How then did this international experiences inform you of what could be a potential role in education that can be played by these kinds of experiences?
Sure. Well, I mean, at the start, I just needed a change. I've been working in the same field for some time. It was
Mhm.
completely random. Most of
Mhm.
my choices are random. They're not planned. I don't think I'm very good for your network. I never have a career plan. I don't know what
Correct.
I'm doing next week. It's completely, something comes up and I try it. And
Mhm.
I dislike planning. I find it
Mhm.
too rigid and I find it imposes too much on me. So I avoid planning. So the
Yes.
move into education wasn't planned. It was random. I like
Mhm.
travel. If and so the education gave me a chance to travel. That's why I did it, not for the
Mhm.
education.
Mhm.
And before I started, I had a low opinion of teachers. Um,
Mhm.
I still do to some extent. I don't like to call myself a teacher. I always
Mhm.
view teachers are people who have failed at something. So
Mhm.
I've been teaching business for 10 years. I've been teaching marketing for 10 years. If I was good at marketing, surely I'd just start my own company. So, I'm good at talking about it. It's the recognition. But I mean, I recognize my strengths and my failures. So it was a random choice. Moving around the world has significantly improved my viewpoint. Obviously, you understand the viewpoint of the country you're living in. You begin
Yes.
to understand the culture, so you can have a much better take on the international relationships and the development of certain countries. So I find
Mhm.
that very interesting. Again, I'm still searching. I'm always searching for the underlying rules that control the economy of
Mhm.
China, or the
Mhm.
underlying rules that will influence how this will develop. That is the
Mhm.
science background. I think there must be. You only have
Mhm.
to understand some certain factors. And if you
Mhm.
understand them properly, the cause and effect, you can then extrapolate to,
Mhm.
a pretty decent guess.
Mhm. But don't you think,
I'm very much a big picture person, but I
yes, so
like big sweeping statements.
yeah, so but don't you think all of these exposure to the different fields and disciplines, so having gone through like the discipline of a field of study in science and then eventually social science, that would be like marketing and interaction, would actually inform you and make you better in terms of like educating people because it's really transformation, right? When you're into education.
Yes, it has. And I think because I was relatively good academically, I wouldn't say I was smart or anything, but I always pass exams. So when I first started, I was a very impatient teacher because I used to find everything easy, you know. So I was always, this is just simple. I can't see why you can't understand this. So in some respects, I'm still a slightly impatient teacher, but it has given me more patience. And I like to understand people's motivations. So the challenge for me is to understand some way to get this message into the person. So it's a communication challenge for me. I don't really get, people say they get a great buzz when they teach someone something and they go and get a job and they've done very well. I don't really feel that. I just like the immediate impact of understanding this group of students' motivations and then devising some communication plan to get the knowledge or the information into their head. That's what I enjoy. I don't get the benefit, oh, I've helped this person's life. I never think that personally. Some teachers seem to, but not me.
Yes, but it would, I'm not sure if it would surprise you having gone through like all of these interactions with people. Many would say that they didn't really have like any master plan of why they ended up in these fields or having this kind of career. Really, it was more of identifying your interests and then finding your aptitude. As you were saying, you were
Yes.
had skill set and you were interested in this, and okay, therefore it's a natural progression, and then later you
Sure.
evolve, as you mentioned.
Yes.
Correct.
It is an organic, but I think there's a difference certainly in the West between like working class families. And so working class families will say to children, it's best to study what you're interested in. You study what makes you happy. But then upper class families or richer families will say, no, you should study this because this will make you money. So there's a difference in the underlying approach, especially the Irish Catholics. I mean, Catholics in general always tell their children, you should just enjoy yourself. You should just do what makes you happy, which isn't advice for the rest of your life. You know, if you don't know what to do when you're 16 or 17. So there is a big difference between cultures. Certainly in the Asian cultures, children are just made to study subjects they have no interest in. They have no aptitude at it. You know, half of the Chinese students have to study accountancy. No one knows why China needs so many accountants, but they're just forced into it. And they don't like doing it, but they have no choice. So that cultural background, I've had a very low pressure life compared to many other people. No one ever told me what to do, you know? No one ever said you should do this, you should work hard. It was literally, I just did it and no one ever told me off. Strange, perhaps.
Yes. You mentioned about this similarity with the Philippines of the Catholic faith, right? And having come from Ireland, okay? And this is something that maybe a little bit of affinity that we have with Ireland and the Philippines. So maybe you can talk about, in fact, that influence of its cultural as well as your familial influence from the Catholic faith. I'm sure our students will be very interested, the Philippines being a majority Catholic country.
Sure. I should start my statement by saying I'm not a religious person and I don't have
not
positive.
Necessarily. That's what I talked about.
No, I know. I don't have
familiar, yes.
I know. I don't have positive views towards most major religions. I just feel we should move on from religions. I think Catholic countries generally don't do very well economically because the message is that you're going to go to heaven anyway. No one ever tells you to work hard, enjoy yourself, be nice to people. You'll go to heaven anyway. And so the reward is afterwards. Clearly, Protestants, obviously the whole of Northern Europe is Protestant. It's work hard, work your socks off, save money for yourself, look after yourself. It's Max Weber's, Protestant work ethic. We all know the story. I think there is some truth in it. Sweeping statements, obviously across the whole country, but I think there's some truth in that. So I was, because I was the youngest, again, I was the youngest child of a large Catholic family. I was the smartest one in the family. So I was the first to go to university, even though I was the youngest. So they just left me alone because I was so much smarter than everybody all the older children, you know. So it was like, this is the boy genius. He's going to save us all. One of us will be rich, you know. It didn't work
Yes.
out like that, but you know. So, and also, if you have a large family, you can't tutor all your children. You
Mhm.
can't physically look after 8, 9, 10 children.
Yes.
Obviously, in China, where they've had one, it's quite interesting. I worked quite extensively in China. Obviously,
Mhm.
for a long time, they could only have one child. When
Yes.
they changed the law and said they could have two,
Mm.
most of the students I spoken to, we were trying to organise a debate. I was working in Shanghai a few years ago, so the
Yes.
debate was: is it a good idea to have more than one child? And
Yes.
we were getting our students to actually discuss this. They were 20 years old, 21 years old, middle
Mhm.
class Shanghai people.
Yes. Mhm.
95% said no, they would only have one child
Yes.
because in China, you've got to invest that much money to get out of to raise yourself up. They're
Social
obsessed with the
mobility.
education, and you
Yes.
can't afford to invest in two children. So they
Mhm.
were saying that they wouldn't have more than one child, even though the policies changed.
I see. Okay, so that's why you think that's really like an influence that maybe might be showing in terms of the level of progress and development in the Philippines. Of course, you have also been to the Philippines. You have taught in the Philippines.
Yes, yes.
Okay.
I mean, you know, I'm not trying to diagnose Philippines economy, but
Yes,
there is
not
an
the
influence.
economy, but the society.
The society, yes, the
Yes.
society. It is notable that most Catholic countries don't do very well. They are more chaotic. They are freer. There's less stress on people. You know, there's less control on people. You know, Italy, the whole of Southern Europe never
Yes.
invented anything famously, and Protestant Northern Europe, the whole of the Industrial Revolution, all the inventions for 300 or 400 years, they came
Mhm.
from the Protestants and not from the Catholics.
Yes.
Now, it's a sweeping statement.
Definitely. And I would have to say, for instance, we talked about Ireland, and this is a very interesting topic that we would like our students to just have a little bit of information about, because Ireland's mostly a Catholic country originally, and then eventually there was a break with England, United Kingdom. So how do you think that has like informed like a lot of like Irish people who had left Ireland because of these troubles or the lack of economic development, as you mentioned, and then how the country eventually did develop in the end.
Yeah, the country developed. Yes, I mean people have been leaving Ireland for the past 200 years, so
Yes. It
therefore
might be
net.
instructive for the Philippines. It
Yes,
might
I
be
mean that. Yes, yes, it is similar. Obviously, the initial Ireland was always dominated by England, and so they always had huge problems there. The initial push for the migration was the potato famine when they all starved in the
yes.
1850s. So that pushed a lot of them out. But it continued after that, clearly, for like 100 years because there was no jobs. The Catholic Church in Ireland was immensely powerful up until the late 1970s. And there was
Yes.
very little growth or development in the economy. It's farms, it's potatoes, it's cows. It still
Mhm.
was until the 80s. It was joining Europe that changed Ireland when they
Yes.
joined the EU because they got such huge funding from the EU because they were the poorest
Subsidies.
country when they
Yes.
joined. And so that gave the Irish economy a massive boost in terms of infrastructure. They've always
Mhm.
had quite good education. They famously have, you know, well-trained people, but
Mhm.
the infrastructure boost and the investment from the EU allowed Ireland to develop, you know, to actually dig itself out of being a backwater of Europe. So that made the big difference, the
Mhm.
availability of the funding. And
So
it's
do you
grown quite well. You know, it's still a small country, obviously.
so do you
It's
see like
not,
some
it's not, sorry?
similarity? Do you see
It,
some similarity of what, by analogy, some of these common characteristics with the Philippines that it might share?
I suppose, yeah. So, I mean, there was the Irish moved and they didn't go back. The Filipinos don't seem to move.
Return.
Yeah, yeah, they seem to return. and they're always supporting far more people. So the Irish would just leave. Everyone would leave Ireland. I mean, there's still only 4.5 million people in Ireland, even though everyone has 10 kids. Everyone's had 10 kids for the past 200 years. The population didn't grow because they just had to leave. They didn't go back. They didn't go back to Ireland. They're all over the world. Obviously, they're in Australia, they're in the USA, etc. I guess there are similarities. I think the weight of the population, can the Philippines support so many people, is what I think when I go to the Philippines. I was just in East Africa. I feel the same thing. You see subsistence farmers in East Africa, they've got 10 children, they're all starving. I feel that about the Philippines. I just think they have too many children.
Yes, and so the population cannot be supported
Yes.
by the current level of economic development.
Yes.
Right?
Yeah. And it was the same in Ireland until the 80s, when it was impossible to buy condoms, it was impossible to get birth control. Even until the 80s, and in Ireland, until the power of the Catholic Church fell. And now people don't have many children. It changed very quickly. It's strange, Ireland, because it was very Catholic, it was very conservative until the late 80s. But now it's one of the first countries that have legalized gay marriage. So there's a very liberal undercurrent that seemed not to be there until extremely recently. But it's become very liberal and it's very tolerant in quite a short period of time.
Yes. You think that was also part of the influence of having become a member of the European Union?
Yes. Yes, definitely.
Investments, yes.
Yes, definitely. I think any I'm very in favor of integration. I think all countries should integrate more and more. I can't stand isolation. I think over the whole of human history, the more we've integrated, the bigger the groups, we've just made more progress. And so when we're all in separate little villages, nothing happened for like 1 million years. You've got to integrate to get the exchange, to get more people to have new ideas. Obviously this is globalization again and traveling around the globe, but the integration of more ideas and different points of view just gives you a better outlook. It's got to.
Yes.
Really,
So
I can't see any arguments against it.
Part of that process of transformation, obviously, is through educating people. That if we are to integrate, as you have this conception of maybe this globalization of integration of humanity, so an important piece of that is educating the people that despite all of these possible differences that we may have more in similarities in terms of our interests.
It should be, yes, it should be. I don't know how you bring that alive in a classroom. Again, I would find that very difficult to bring alive in a classroom. So if I'm teaching marketing and I'm in China, I'm talking about the products that these students are buying. I'm saying you've bought Nike shoes because X, Y, Z. Now, I don't know how you do that if you traveled more and talked to more people, it would be good for you. Well, how can you demonstrate that, or how can you highlight that? I don't know how you do that.
Yes. Well, one of the experiences that you've had is like immersion. Immerse yourself in different cultures and different situations or contexts may be an effective tool to transform people, right? Because they become empathetic and things become relatable.
Yes.
Because experience, correct? In addition to the theoretical and the conceptual.
Sure. That is expensive, and I think it's for rich kids. I think rich kids can travel on their school holidays and experience different cultures. I'm not sure about poor people in Ireland or the Philippines or elsewhere. They don't have the same opportunities.
Yes.
Sorry, go ahead.
Talking about opportunity, so we actually wanted to have this virtual broadcast. In a way, it's kind of a vicarious method to let people experience different concepts, different ideas, possibly through different experiences of what they would not normally have in a common day occurrence for them, to have this opportunity to speak to people with different perspectives. And so I would think that through this process of like transformation in education, so what can you say to a young person who is probably now like in the process of trying to actually decide or figure out what it is that they're going to be doing in their life? So you probably be talking about the 18 to the 20-year-olds, our students.
Yeah, sure. I mean, again, I would follow the simple one that you should do. You should probably pursue the subjects that you are interested in, which is the worst, which is the answer that I told you was the wrong answer. But
No, there's
I
no.
think I think you can make money in anything. I think you can be successful basically in any choice, certainly
Mhm.
from your choice of degree at a university. Certainly in the West, I mean, I started off, I did biochemistry at a university, and then within less than 10 years, I was in the marketing field. And certainly in the West, Western companies don't view the type of degree as limiting, and so they don't say if you've done a math degree you can only do math. I
Yes.
seem to see that more in Asian countries. Asian
Mhm.
people are always saying to me, why do you teach marketing if you did biochemistry? And to
Mhm.
me it seems a redundant question, but there's a
Mhm.
literal interpretation, certainly in China and South Korea where I've worked, where they just find this so confusing. So you
Yes.
did biochemistry, but now you don't. And it's like, well, everyone does this in the UK. It's perfectly
Yes.
normal. So many of
Mhm.
the students that who were also doing biochemistry and biology, they went on and they became accountants and like myriads of different things. Very few of them work in science. Less than 5% of them still actually work in science.
Mhm.
So
Yes.
but that was at the time in the early 90s. There was a massive demand for accountants and
Mhm.
financial experts. So
Mhm.
you could take your actual understanding of science and math and just move into finance. You
Mhm.
didn't obviously you don't need a first degree in finance to work in that field. Now that's true in the West, so the choice is less important. So I
Mhm.
would the choice, the actual subject for your first degree. So I
Mhm.
would say if you're good at a subject, and if you're good at a subject, you're normally interested in it, you
Mhm.
pursue that, and then you go to the best university you can.
Yes.
Even if you think the subject you're doing doesn't automatically give you a job,
Mhm.
it will still say UP on your CV, and that's all that matters, because your first job, all they're looking at is the university. That's all they have to go on. So you have to go to the best university you can, get the highest grades. You're a selection of subjects. I think it's the one you're best at.
So with that, I
That's
think
simple
we had
advice,
the
isn't it?
most interesting discussion, to say the least.
It's simple advice. Simple advice. Just do what you're best at
Exactly.
and go to the
Exactly.
best university you can. And then
Yes.
you're leveraging the university to get better and better jobs all the time. I think that's the
Exactly.
only thing you can do. That would be my advice. If I was born into a richer family, I would be a doctor now, obviously, because I
Yes.
was good at biology and chemistry. I should have been
Yes.
a doctor. I don't like sick people. I never wanted to be a doctor, so that was a non-starter. I
Maybe you
can't
had
stand.
averted the pandemic, right? By not becoming a medical doctor, right?
It wasn't an option for me, but there you go. So
Yes.
yeah, simple advice, that isn't it, April?
Yes.
Do what you're best at.
So with that, thank you so much, Dominic. I'm sure everybody found that such a fruitful discussion, something
I hope so.
out of the left field, and certainly not something that would be a common day occurrence for our audience.
Thank you. Thank you for the opportunity, April. It was nice to talk to you. I hope all your listeners and viewers learned something, hopefully.
Yes. Thank you so much. And so we will be right back.
Thank you. Bye-bye.
And April M. Alcazar. This is Triple A Live, airing every Wednesdays from 6 to 7 in the evening. So this is where your academic goals are advanced and achieved. For tonight, we have a specialist in emergency medicine, Dr. Paul Bronson. Can you please give some greetings to our viewers for today?
Well, I just thank you for inviting me, and what I hope that some of my past experiences and how I became a doctor and an emergency medicine physician may give you some information that may be valuable to you. We'll just see.
Well, thank you so much for giving us your valuable time. So I think we'll really have to start with the interesting part of your career, which is when you were a young person. What sort of interest did you have? And how and when, if you do remember, when you actually decided that you wanted to be in the field of medicine?
Oh boy! All right. Well, when I was young, I was I remember I had some chemistry sets a little bit, but I really wasn't that much into chemistry. When I was in school, primary school, I hated the sciences. They were boring. I didn't see the relevance of it. I liked history a lot. I liked art, that sort of thing. And then I got really poor grades because I just wasn't into school. But it was after I graduated and I went into undergraduate school that all of a sudden things started soaring, and I became very interested in learning. But still, when I was an undergraduate, I still wasn't interested in the sciences.
But did you go into a science undergraduate program? No.
No, I did not. It was liberal arts. I graduated with a bachelor's arts from Berkeley in psychology. And when I graduated from Berkeley, I was a little smug, and I thought I was pretty smart, I got straight A's there. It's a good school, but I had no scientific background, and I didn't understand at the time. Now I do. That there was a big hole in my ability to critically think, and just to analyze anything in the world. And so, but I didn't know what I wanted to do after I graduated. And basically, I just started taking odd jobs and bumped around and traveled a lot. And then somebody gave me some very good advice because I couldn't figure out what to do. They said, volunteer at different types of places just to see if, what kind of turns you on. And one point I volunteered at a medical clinic.
Okay, and this was in California?
It was in California. And that's when I started getting it. I started really thinking about it. And then I decided, and at that time, I didn't want to go back to undergraduate school to take what we call pre-med here, which is all the biology and chemistry and physics.
Exactly.
And but at that time, Italy had in their 6-year program, because they don't have an undergraduate school system there. They just go from high school to graduate school. They have a 6-year program, pre-med and med together. And at the time, they don't have it now. They were taking some Americans with bachelors of arts degrees, and I traveled a lot, and I loved Europe. So I went to Italy, and I got my bachelor's of arts degree there. And at times I would come back to the United States, and I would sit in on some courses at UCLA, and I did some clinical rotations here. And then I came back here, and I had to take the same type of exams, qualifying exams that the American medical students had to take. And then I went into the traditional internship and residency here in the United States, like everybody else has to do. But I wasn't really ensconced into the medical system a lot in the United States until I started my internship. Luckily, it turned out good, and I liked it because it could have been a disaster. But it turned out right. But for me, it was important because especially for emergency room doctors, we're kind of a special breed. And most doctors, if they're honest, will say they don't want to be emergency room doctors. They're scared of it because it's so unpredictable. It's controlled chaos, and you never know what's going to happen. And we have to make split-second decisions with not a lot of information and without complete information. And the decisions we can make as far as maybe pushing a drug or something, it could kill them or it could save them. And sometimes we're trying to figure that out, and it's not fun when you're in that position. But
but when you were talking about your learning experiences, right? As you said, you were actually in liberal arts. So what sort of skills and proficiencies did you even develop as a young person that eventually informed and made you think a much more knowledgeable doctor eventually? Of course, you talked about the sciences, which you didn't like at first, but there must have been some other skills that you actually brought to your practice eventually.
Yeah, I was a waiter in a restaurant.
Yes, and so
No, seriously, let me tell you something.
okay.
As a waiter at a restaurant, I needed to get good tips, and I had to go from different table to different table, and there would be
Sure.
different types of people at the different tables. You know,
Yeah.
there would be students, business, all different types of people. And in order to ingratiate myself to get good
Yeah.
tips, I had to be a little bit of a chameleon in order
Yeah.
to interact with them and be friendly and charming to them, but with different types of people.
Exactly.
And I had to do that quickly. And seriously, in the emergency room, we're dealing. You know, the people are scared when they go. They're sick. They don't know you.
Yes.
When you go in, you're a strange doctor.
Yes,
And
exactly.
very quickly, it's very important that they get comfortable with you. And they trust you, because if they don't, you're not going to get as thorough a history about things.
Yes.
And if you don't get a thorough history, you're going to make mistakes.
Okay.
And so they've got to trust you and feel good. And so this sort of charming ability to get along with different people. Seriously, I learned, well, for a little bit from my dad, but also seriously from the restaurant. And and
It's the hospitality
that served me
industry.
well in emergency medicine, because you have to jump from room to room with different people, and you've got to make contact, emotional contact. I'm not talking about just intellectual, emotional contact very quickly. And it's an important skill to have.
So from that, how eventually did you take on the career trajectory that you did? Because then you talked about non-traditional medical school that you went to Italy, and then eventually, what happened now when you did the internship and the residency, and then eventually into the practice?
Right. Well, still at the end of my medical school in Italy, I still had come back to the United States at times, and I did rotations in surgery, pediatrics here a little bit, and then when I did emergency room, I loved it. I thought it was exciting, and I just absolutely loved it. Other people would be like scared, so I don't want any part of this. And so that's how I decided to choose emergency medicine. And but still, I didn't really have a sense of what I'd be going through and the stresses, because I was forced into situations that normally I would have run away from. I had no choice. When multiple people coming in, some people dying, and and you're wishing in the back of your mind, oh, how did I get this shift? I don't want to be around here. Oh, this is a horrible decision being a doctor, you know, because you get scared. But working through that is important, because it stretches you out. But also, you know, you have senior physicians that are kind of watching over you, making sure you don't screw up too much. But it was a pretty traditional residency program, and then we had to take, you know, exams every once in a while. We had to take national exams as we're going through the system, to pass. And I did my residency in a county trauma hospital. And that's where I did my residency in emergency medicine. And so we saw a tremendous amount of trauma.
Surgeries were also conducted.
Yes,
when you go
but
to
it's very
trauma.
interesting, depending on where you train. Every hospital in different cities, it's a different culture, and you tend to see different sets of people with different sets of medical problems. But training in a trauma center as an emergency medicine physician, I think, is very important. Simple, at least for one thing, is that you got to get used to handling fear and making decisions. And it's not like you should become insensitive, but you need to kind of lock it in a box and just put it to the side for a moment.
Yes,
in order to
presence of
think.
mind.
Because otherwise, if you're scared, you can't think clearly. And so you got to put it up. But I'm not saying that there were some doctors, they become so insensitive to people and they don't know how to communicate. I'm not talking about that.
Well, you studied psychology, so what would you actually characterize that kind of behavior in terms of being able to compartmentalize, correct?
No, I'm sorry, I don't understand.
So, because you studied psychology, you talked about like setting it aside when you have to deal with a particular emergency case. So, isn't that having the ability to compartmentalize different situations that you find yourself in?
Yes, but I didn't learn that from studying psychology. I'm just saying this is what just happened when I was there, and I was able to do that. But that's something you have to do. But I mean, if somebody's interested in going into emergency medicine, or if you're an educator and you're trying to pick out what students you want to have in your residency program, you know, I'd strongly suggest that you'd look for people that have done some adventurous things in their lives, that can handle stress, that you think that can make decisions when they don't have all the information. That have somewhat more of a balanced life. I think that's very important. And people that are deciding, if students are deciding if they want to be emergency room doctors or go into it, volunteer at an emergency room. See what it's like. Go in there, because your fantasy of what you think it's going to be like frequently is so much different than what it is. And then talk to emergency room doctors that are in the residency. How do they like it? Because what you think about it, and then the training's different. And then when you're done and practicing outside the training, that's also different. So talk to emergency medicine physicians that have finished their residency, that are actually practicing, and then ask them about the politics. There's a lot of politics. Hospital politics sucks, really. It's disgusting. It's not very much fun, but you, as an emergency medicine physician, you have to be able to deal with it in a constructive way. So there's all kinds of different pressures that go on, and as much as you can to get practical experience by volunteering and talking to a lot of different people about it, it increases your chances, I think, that you'll make a right decision, and it may increase the chances that the people that are on admissions committees that are looking for people, because it's not just, if you're just looking at if they get straight A's or if they have national exams, if that's the only thing you're looking at, then you're not looking at the right things. Because I'm you know, 90%, 95% of the things I learned in medical school, and you know, I never used it in emergency medicine. It was a waste of time. I mean, in terms of you pick up the information. You don't need to be a really good emergency medicine doctor. You have to have common sense. You have to have maturity. You have to know when you're scared. You have to admit it. You have to know when to get help and to ask for help.
Exactly.
And these are qualities that are not graded with, you know, in school, the A, B, C's, and D's. These are very important qualities. And you can have somebody, I have a friend of mine who's a professor of medicine. He's brilliant. I'm not even close to him in what he can do. He'd be a horrible emergency room doctor.
Yes.
He'd be terrible at it.
Yes. So now you're talking about like what an emergency medical doctor should be and what he should not be. So definitely, if you could state equality in a word, what would an emergency medical doctor should possess as a quality?
Well, they can handle stress, and they can make critical decisions when they don't have all the answers. They don't have all the information.
Yes. So that means it's really having the presence of mind to be able to deal with the situation that you're faced at the very instance, right?
Not the presence of mind, the presence of emotions, to be able to deal with your emotions. Not talking intellect here. I'm talking if you're going to be a researcher, there's different types of intelligence. Intelligence is academic intelligence, and there's emotional intelligence. These are different qualities. And so I also was different too. I mean, I had gone through just some therapy just throughout my adult life, which gave me great insight into myself, emotions, and this sort of thing. So, you know, these type of things, I mean, I personally think, I don't, you know, most people can't do it, but if they can take some time off in between their studies and just to travel around, to do things and to learn about life and to put themselves in different situations. Also, like I said before, you're jumping from room to room to room, and you've got to be able to communicate, and you've got to be able to look at people very quickly and size them up and see if they're scared, see if they're trusting you, see if they're giving you correct information, because sometimes they don't. And you've got to really know, because, you know, you ask people who have chest pain, no, where you don't really go into it and say, well, is there any discomfort? Well, yeah, I feel some indigestion here.
Yeah.
Well, I mean, so, you know, but these type of subtleties, some of it is not just you learn in your residency, you learn from life experience. So life experience is a big deal that I think that educators that are thinking about choosing who should be in their emergency medicine program, I think that's something they should really think about. And then people and students that want to go into emergency medicine, they should think about getting just some life experience.
Okay,
so it's unique. The way we work up patients and the way we deal with things, and you have to multitask. It's controlled chaos in an emergency room, and you have to multitask. And you're doing things, and the family's making demands, and the patient is, and you have your nurses and your techs and other physicians, and you're being pulled left and right all the time, and yet you have to keep focus, otherwise you'll drop things and you'll miss things. And so you've got to have the ability to do all these things and to keep yourself calm to do it. So it's I'm telling you, it's a unique personality, and it's a unique way in how we work up patients. It's different.
So I think that presence of emotion that you really emphasize seems to be such a marked characteristic. And you're not talking about like the skills, the competencies even, but when
you learn that after after a while. You can but you need to be bright. But you don't have to be brilliant to be a good emergency room doctor. To be a researcher, maybe you have to be brilliant.
Sure.
But no, it's different. The skill set is different. It's unique.
So I think with this like unique skill set that you're talking about, so if you were before a group of medical students right now who are on the cusp of making that decision, what consideration should they be thinking about if they want to be in emergency medicine?
Well, first of all, before they make that decision, they should volunteer or at least have some of the rotations in emergency medicine. I mean, they've got to see what it's like, and they need, like I said earlier, they need to talk to people, doctors that are in their residency in emergency medicine and afterwards. I mean, they have to try to get as much as they can a realistic impression, though it's still difficult. And again, if they have real life experience, I mean that always helps. I would encourage that if they can get it. But unfortunately, sometimes you just don't know. There are doctors that choose a certain specialty, they do it, and they wind up they're unhappy. They don't like it. But to just increase the odds that what you choose will be something that you love, as best as you can, you need to explore it as much as possible. And also you should have you need to have an outgoing personality and a strong personality. If you are somebody that tends to be a wallflower and very passive and very quiet, that doesn't serve you as an emergency medicine physician.
Yes, because you have to be out there, and as you said, talking to people, to the families, to the people who are having emergencies.
Everything. I worked in a place where we used to have crib deaths, SIDS a lot. And I'd start off my morning, 7 o'clock in the morning, they'd bring in a SID, the baby would be dead, and I'd be having somebody else would be having seizures and chest pain and other things. And I have to walk in and I have to tell these young parents that their baby, is dead, and they're having to deal with that emotional crisis and dealing with them while in the back of my head I'm thinking about this chest pain person, this seizure, and this other things. And so all this is going on at the same time.
At the same time, right?
At the same time in you. And you gotta be kind and understanding with the parents, obviously. The parents, it's just a horrible, nightmare for them. And at the same time, you've got to get back to your other patients too, and then put it aside and go on. And that's just the beginning of my 12-hour shift.
Right?
Yeah.
So would you recommend it? So now that you're, I think, at the end of your career, would you recommend it to medical students, medical doctors, emergency medicine?
Well, yeah, but only if you're suited for it. I mean, for me, it was wonderful. I mean, it allowed me here in the United States that I could work as little or as many shifts per month I wanted. So I was able to go into other fields. I became head of a national ethics committee. I did medical legal consulting while I was also doing emergency medicine. So it allowed me to also to do other things too. And it was a life, but I didn't understand. I didn't know about that ahead of time. I found out afterwards what a great lifestyle it gave me, and I loved it. But again, I recommend it, but only for those people that are suited for it. And people are trying to decide if they want to do it. They just need to get as much hands-on experience beforehand to have an idea if their personalities are suited. And the educators need to look at these people and don't put it. Look, for an internal medicine, you have to have maybe be academically smarter. If you're an internist, it's different skill set.
Exactly.
But emergency medicine, you got to look at, other things.
And these are like more of the personal skill sets and qualities that you've already
mentioned. It's important. It's very important.
Crucial I think
after years of being in residency, you pick up the information. I'm not brilliant. I'm smart, but I'm not brilliant. When I was in college, I had to study hard. So there's some people that can just do it in residency. I had to work harder probably than most.
Yes.
But
to get through it.
But still, it sinks in. You get the information. But if you're not a person, if you're arrogant, if you can't ask for help, if you can't make judgments about things, if you don't have common sense and street sense, you're going to be a lousy emergency room doctor.
See, so with that, definitely, I think you gave a little bit of a sense of what you said, the controlled chaos with the personality and your very energetic advice.
Oh, am I? I didn't notice.
Yes, very energetic advice that you gave to our viewers. So, any last words that you would like for them to really think about when it comes to emergency medicine, especially because we're dealing with actually health and medical crisis, especially from the last year. And a lot of our medical frontliners were really out there giving that kind of service, and specifically also for emergency medical doctors and personnel.
I mean, I'm not sure what other advice I can give. There's the American College of Emergency Medicine, ASAP, that I would suggest strongly. I mean, we were the first country to and we're the leaders in the field of the world of emergency medicine in the United States.
Yes.
The residency started in the late 70s, early 80s, late 70s. And so it's very well established, and they have all kinds of educational material, and they have policies and procedures that are very good. They have different people set up at different they have different skill sets that like to teach. And so it's a place that you can go to also to get help. If you want to set up your program, if you want to expand things, contact the American College of Emergency Physicians. They more than happy to help out. I know they are.
Yes.
And lots of times they have programs where they have exchange programs where residents go to different countries.
And you mentioned from the very first experience that you had the volunteer to a medical organizations. Do you still continue to do that, or would you really encourage young people, even if they're not going to be medical doctors, to volunteer themselves?
I'm not quite sure your question. I'm sorry.
Okay. So your very first experience, how it sparked your interest in medicine, in fact, was because you volunteered, correct?
At a medical clinic, yes.
At a medical clinic. So would you recommend that to our young people, even if they're not planning on becoming medical doctors or even allied medical professionals at all?
Well, yeah, because you may not think you like something and all of a sudden do something and go, wow, this is really kind of interesting and cool. And I volunteered at a district attorney's office. I volunteered I did different things. And so, it was the best advice I got from anybody. After I finished my undergraduate school, I had no idea what I wanted. I knew I wanted to contribute to society, and I knew I liked working with people. Those two things I knew. And so whatever field I went into, those two things, criteria I had to fulfill. But I didn't know what. And they told me volunteer at different places to see. And that was the best advice I ever got.
So exploration before you determine what your interest and aptitude is.
You're right. And then the same thing when you're in medical school. You're going to be going through clinical rotations and go through different ones. And ask, talk to the different residents and talk to people that have finished to see what the actual practice of your specialty is after you're done with your residency program, because it can be markedly different too. You don't want to go through all that training and everything and at the very end go into a specialty and then be unhappy.
Yes, exactly.
And if you're unhappy, you're not going to be as good as if you're happy,
So I think from our major takeaways here, definitely exploration, interest, aptitude, and life experiences is what makes the difference, I think, in our
You did a very good job in summarizing up what I've been trying to talk about.
So I think it's been such a pleasure to have you on our show. We hope that
It's my pleasure, my honor.
yes,
Thank
so
you.
I hope that our viewers had some very valuable insights. So thank you so much to Dr. Paul Bronson there in California. So we'll be right back.
Yeah, and if anybody who's listening, if you can give them my email if you want to, if they have specific questions, they can email me. It's fine.